So today I was going to talk about the results from my PET scan and meeting with my doctor. The PET scan went well, and kind of similar to a CT scan, except just takes longer and the prep is a little different. But the results are to basically put in a slightly radioactive sugar into your system and see what lights up as it was. And when you see the results, you actually see the results on the screen, you understand why they talk about it lighting up, because it images almost like slices through your body as it scans, but it takes longer. And the reason why is that it's trying to pick up those trace elements, the radioactivity. And as the scan goes through your heart, you can see it glow. So it's a dark, murky image, and then suddenly it gets to your heart, and then there's this orangish red showing the outline of the heart because that's working, drawing energy. And then it gets to your kidneys and all that. Well, the PET scan didn't really show anything lighting up, which is great that there's no active spots of cancer they can see with the PET scan. The downside of that is because we have the blood test that said there's something going on, there's not this spot that they can say, aha, there it is. We can hammer it and take care of it. So we decided to start up chemo again and continue with chemo for a period of time until we can do the blood test again, because the blood test we can only do every 3 months. Insurance and the company, blah, blah, blah. Everybody has to deal with that kind of stuff, right? So we'll continue with the PET, with all that stuff, based on the fact that the PET scan did not show a specific area to attack, and move on from there. Now, my doctor did say that she has had patients that have had a bit of a blip with their blood tests, and that's gone away on their own. And I don't think she wanted to say it's a false positive, but she was kind of indicating that sometimes things can be picked up in your blood that don't necessarily develop further. But out of abundance of caution, we were just going to continue with the chemo. So that's what we're doing, and I'm fine with it. Little shift again, dealing with the chemo and the meds and everything. This time, I'm deliberately not taking one of the anti-nausea meds. It's one that you take one time at bedtime, and it makes you need to sleep more, and also makes you tired during the day. So far, been okay with it. I've been a little bit more nauseous throughout the day, just lack of appetite sometimes, but normally I have a cast iron stomach, so I'm hoping that I can just muscle through that a little bit more, and I do have my other meds to deal with it. But it's a choice, and just trying to, again, have a good quality of life as we're moving forward and dealing with this. So results are nothing definitive from the PET scan. Going to be doing chemo to try to make sure that nothing else develops, and monitor and see what happens. I hope everybody is having a great day. Thanks much. Bye.